And hello once again from the headquarters here at the Association of PEMF Professionals. I am Jerry Dreessen, the Executive Director here at looks like it says, oh, had a little bubble pop up. Sorry about that. We are going live here, so I just need to. So funny how you get started and something just pops up right in front of you. And I'm just going to delete that. There we go. So we're live, but just not on LinkedIn today. That's what that's what the compliance gods were telling me. So hello and welcome to our uh, third of five installments here today. Of course, we've got our Thursday live, and we are continuing on with our series with our who, what, when, where, why, and how. And we are going into our when, which is number 3. And we kind of did a little play on words here. We're going with when not to use PEMF. We have a pretty good idea already from our who and our what. And we are jumping into the when side of it, because a lot of us are using PEMF and there are contraindications as far as what's going on. And what I want to do is walk you through that. And again, welcome to our 5-part series, the who, what, when, where, why. We might throw in a number 6 for the how, for those of you that are the stickler for details when it comes to the 5 W's. And so what I want to do is just jump right into it. It's like when not to use PEMF. And for a lot of us, there are, I don't know, we pretty much have a good idea of when to use it. But when you look at the true definition of contraindication, it is a condition or circumstance that suggests or indicates that a particular technique, or in this case, drug, on this definition, should not be used in the case in question. So that's the whole enchilada there for contraindications. But just kind of going through our list, and this is why being a member is really good too. We have all of this in our training. So when you become a certified member, you have gone through all of this, including the contraindications. So it's kind of a tip of the iceberg, and why it'd be great for you to join and become a member. I'll talk about that a little bit later at the end. But we have all of this tucked inside our members area. So it's always available at your fingertips. But for right now, those of you that are new to PEMF or have one and you're wondering how to use it and when to use it and when not to use it, these are some really important ones. So anyone with an implanted electrical device, including pacemakers, the cochlear implants, intrathecal pumps, TENS units, cannot use PEMF because the magnetic field can disable or shut the devices off. And how that happens is when you're using PEMF, it creates this magnetic field that can get into the wiring of the device, go into the little microcircuitry, and just kind of create too much of a, I guess, amplitude or ohm or signal, and it kind of melts the system microscopically, and that is not what you want. One of the other things too, in fact, we're going to go into the next one. We'll go through this list and I've got one more to add to it. But persons with active bleeding or hemorrhaging conditions cannot use PEMF. The body is in the process of stopping the blood flow. So your capillary system, those of you that know all about bleeding and coagulation and scabbing, all of those markers are present trying to help your body start to begin to, the fibrin and fibrinogen, creating the little lattice that catches the blood cells that coagulate that's what you want. And this system helps not have that happen. So you definitely want to stay away from that type of a condition. And currently, they've not been proven safe for pregnant women. So, I have people contact me and they say, well, I've got a pregnant woman, but her problem's down in her ankle. If I were to do that, I would make sure that I'm, coming from away from the person to their ankle and just working on their ankle and never having the PEMF anywhere near the womb. And I think personally that would be okay. But I'm not the person using the PEMF machine, so I cannot sit here and tell you that it's okay, because I don't know how you would use it, and I don't know if the person using it would pick it up and just hold it against them while they were reaching for their shoes or something. There's something wonky that could go on. So unfortunately, we don't have everybody that has a common sense brain when they're using PEMF, and they may totally forget about it, which is what the one I want to talk about here in just a minute. I'm going to go through a couple more here. So can you overdose on PEMF? Well, so far, what we found is the answer is no to that. You can repeat treatment several times during a year, weeks, months. I have people coming in using it, 2 to 3 hours, 3 times a week, based on what they've got. And it's either low or high setting, depending on if we're working on the brain or we're working on an ankle. But it's especially great for, arthrosis, which is, joint issues, arthritis, which is joint pain, osteoporosis and joint pain. And again, if you're healing bones, so, broken bones, things like that, the other great things PEMF is known for. However, there is no risk of overdosing. Usually what happens is the person's area that you're treating gets used to the angle that it's being used at. So oftentimes swapping the angle, or again, what we go through on our training and the certification is having the person that's using the PEMF device go through certain types of movements and motions so that they are continuing to put the area under care under a different field, either with motion or using weights. So again, if you want to learn more about that, it's in your membership area if you haven't seen it yet. And then another one, this just popped up a couple of days ago. So again, thanks for jumping in there. I've got and showing me this one. I won't say your name because you didn't give me permission, but they had a person that had a Medtronic interstimulant implant, and this is a device that is underneath the skin, and it goes in and it lets the person know when their bladder is full, because they cannot tell when their bladder's full. And so this device is Bluetooth, gives them a signal, lets them know. And it's got this device. It may or may not be shielded, but again, there's a wire that goes down through. You can see how it goes down into the sacral area to pick up the signal from the nerve. If you are using your device, it may go in and it may shut it down. If you can imagine somebody spending all that time on surgery to have this implant only to have it shut down because of PEMF. And they were asking me, this certain member was asking me about using it on the neck of this person. And again, it may be all right, but I don't know if you've ever touched a person's skin that the PEMF device was on and you could feel that buzz or that little electrical, we call it a galvanic response, but you can feel that. Well, when you put it on somebody's shoulder, you can feel it all over, you feel it all the way over on their other hand. Well, you can actually feel it on the skin of their ankles too. So this PEMF is going across the skin, I believe, all over the body. It'd be great if we could find a device where we could actually see PEMF, because you would see how it lights up all around the body. So that being said, even if you're treating a neck, this galvanic response that I'm talking about is going to ride around the body, could be going over this area and shutting it down. So it may not have a problem at all, but again, it's better just to say, sorry, I can't, because we don't want to, cause a problem. Hi, Maureen, watching in Chicago. So you're already into the afternoon over there. Going further down here, we are another, again, contraindications is so far, I've not ever seen a earpiece Bluetooth go dead, but the outside stuff. So Bluetooth earpieces, definitely the fobs, the key fobs. When I first started, I didn't go through my checklist, and I assumed the person sitting down. I was at a powerlifting event, and I was just, people were lined up. We're doing 5-10 minutes on an area, and I would tell the group, make sure that you have your keys out of your pockets and you drop them in this little container. And that person wasn't listening, and I didn't ask him a second time. Sat down, worked on his quads, and I was like, "What's in your pocket?" And he reaches in. It's his keys. Oh my god. I said, "Your keys may not work." He goes, "That's okay." I don't think he realizes how expensive fobs are when you go to replace them. He did come back later on. He goes, "Yeah, you're right. My fob doesn't work." So I've actually ended a fob's life by not making 100% sure that the person that I told listened to me and followed through with what I said. In my clinic, I have all of the questions that need to be asked of a person prior to using PEMF printed out on a sheet of paper that's right in front of our machine. So when they sign up to come back to use it, they've gone through the list and said yes to that. But again, second set of eyes, checks and balances and stuff going on too. So we're trying to make it easy for somebody to not fail. Hi, Jackie. Thanks for joining me today. And there's, what do we got? One more here. Oh yeah. And then organ transplant. So again, PEMF is good at making the body do what it's supposed to. When you get an organ transplant, you're on drugs to make the body do what it's not supposed to do, which is to allow a foreign body inside your body. So just be careful if somebody's got transplant in there, that you stay away from it, because you want the medication that they're taking to allow that transplant to take, and that the body's immune system doesn't detach what's being done, thinking that it's a foreign body, or attack it. So that's the other big one. The other one I didn't put on here, some of you have seen the video, it's floating around, of me taking, it's a model of a disc. So it's got the two vertebrae disc, and you push it down, and you could push it and make the disc kind of squish out. And that's what I show patients. This is how you herniate a disc if you put pressure on it. It's a really cool model. For people that have a herniated disc or have a disc problem, if you put the PEMF right over the area, all of the muscles in the core surrounding that vertebra are gonna contract a little bit. So you can actually take a herniated disc and make it worse by putting PEMF on it if it's new. And one of the problems that I had, learn from my mistakes, everybody. One of the problems that I had is, it was a chiropractor. I said, put this over the area. We're going to put it on low. I do not want you to feel it. I don't want you to feel it. It's going to be very low, and we're going to need to do this, 4 or 5 times. And he's like, well, why can't we just do more? It's like, because you can't do that with your disc. So I walked away from, we have a little area in our clinic where people use it, and I can see what's going on. But I went and adjusted a patient, and then I came back, and he had reached down and turned it up more. And I said, what are you doing? He goes, well, I couldn't feel it. You're not supposed to feel it. You are not supposed to feel it. There are times when patients feel it, or when people that you're working with feel it. It's okay to feel it. But in his case, I want it on the lowest setting. And I have one of the analog dials. So, it turns, it's almost 2 times around. And so it starts very low. It can go all the way up to max. He had about halfway up. And I just shook my head. I knew what was going to happen. And so I said, well, you're probably going to be a little sore. Make sure you ice it. Because the other thing that happens is, when these discs are squishing, if there's just a pinhole leak and some of the fluid in the disc comes out, that's just like pouring battery acid on a nerve. And when we are, I think, up to age 18, Hannah, you left a patient alone during treatment. Yep. Yeah, that's what I did. But they weren't alone. I could see them through the corner of my eye, but they'll do that. That's that common sense thing. But getting back to the disc, there's a pinhole leak, and you squeeze it, it's going to squirt out, go on the nerve, and that person's entire nerve that it's touching is going to be on fire. It's interesting that fluid, when you're 18 and younger, it doesn't bother you. It doesn't irritate you. So again, you can be young and have a disc injury, but then when if you still have that pinhole leak, you may carry that across into your 20s and can leak on it. So, anyways, bottom line, that doctor called me that night and he goes, "Oh my gosh, I am in a lot of pain. Now I know what you were talking about." It's like, well, why did you go the other direction? He said, "I thought that I would get a better benefit by doing more." And obviously he did not listen to me. And again, that's, I think, probably the key story on all of these contraindications is, even though they look at a sheet of paper, they check things off, you look at them straight in the eye and you say, these things, these are contraindications. Some people may not be listening. But the fact that they read stuff and they signed a piece of paper, that's your protection stating that. But again, it's always good to go over the thing saying, now remember, if you have a pacemaker and I'm putting this on you, this could stop your pacemaker. And that will wake them up. So anyways, we have those checks and balances on our membership site. That's all part of our certification training, the do's and the don'ts. And again, the why nots. And hopefully you've picked up a few why nots, or when nots on how to do that. And again, we go a little bit more in depth on all of these systems too. If you haven't seen them, you can definitely jump back into our 3-part series that we did prior to this one. We talked about the brain, we talked about the bone and the body. We go over a little bit more on that too. I talked about our certifications. This one's a little blurry, but we have general, we have small animal, large animal, and human. For those of you that are looking to learn more, that are maybe wanting to break out into a business, we have certification. If you're a manufacturing PEMF company and you're looking for a way of educating your clients that purchase PEMF devices from you, we are white labeling our education system, or they can just join our system and that can be part of what you have linked up. So we can put that together too. Hi, Sarah. Welcome to Seattle, Washington. And we got Gustavo. Welcome to the show. And again, we've got plenty inside our membership when you become a member. And then also, I announced this a couple of weeks ago, but our website's been updated. So we've got some great things going on in there. There's still a couple of things we're going with, as far as changing out. But it's now, you can find people on it. You can find yourself on it if you're certified. What we are putting together now, this little, you can see up in the right-hand corner here, this member ALPP, to have that little logo or little bug on your website. So when people click on it, it'll take them to your membership directory on our website so people can see that. That's what we're going to be kind of in the works. We also have, of course, our continuing education. That's where you find it, is under the education. On the next, on the left side where it says about, if you click on that, here it comes. Drum roll, please. We have our merch. Our AOPP merch is now up and rolling. So you can hop in there. We've got, we're just starting out, so we've got some really cool things. We've got the shirts, we've got the jackets, we've got some stickers, we've got the vests. So check us out. We would love to have you wear and broadcast that you're a member of the AOPP. That would be so cool to see people walking around with these. I've got mine on order, so most likely next time I do a broadcast, I'll be presenting my merch also. That would be good. Now, some of the other things we do is we work on the legislative side. So, I've done this on the other talks, but, let us help you. And how you can do that is we have a petition that is out on change.org that's designed to help educate the veterinarian boards that are, for some reason, changing their laws that only allow veterinarians to use PEMF devices on non-owner animals. And we've got our goal is to hit 1,000. As of yesterday, we're 917. So we are this short of hitting our 1,000 goal. So those of you that are watching this at the live, but to answer Hannah it is recorded. So you'll be able to see on our Facebook page, on our YouTube. You'll be able to pull it up after it's done. It'll lock it in, and you can watch it and rewatch it for as long as you want. But yeah, you can pick up the beginning of this too. And you can watch the rest of our series as well. So yeah, jump on. Here's the QR code. You can take a snapshot of this so that you can show your friends and they can take a snapshot of the QR code. Takes them to this spot right here where they can fill out on change.org, where they can fill out the form. And again, we're only 83 signatures away from 1,000. Every time we do a broadcast, we get at least 100 people signed. So I'm assuming that with this, by next week, we'll have hit the 1,000 goal. So thank you so much for that. Again, this information gets sent out to the states that have already closed us down on the veterinarian board. And there is a video, Hannah, you're talking about, watching it recorded. There's also a video of this whole system, as far as, the letter that we have that you can, send out, the people that this goes to. So go back into our archives and pull that out too. So again, I want to thank you so much for hopping on with me today. And again, this is the when not to use PEMF versus when to use it, because most of us already got that figured out. And part of our series that we have on the who, what, when, where, why, which means we've got 2 more to go, which means next week it'll be the where, like where should you use PEMF? And we'll get a lot of that figured out, because there's places on the body and there's places as far as how you get your station set up for it. So again, things you can do is like and share this video. Again, we're on Facebook, Instagram, YouTube. Unfortunately, we're not on LinkedIn today because it didn't link. So it'll be most likely posted later. I was looking at Gustavo's. Will you recommend to use PEMF and ultraviolet light mats to do yoga or Pilates at the same time? I'll have to look into that. In fact, shoot me an email and explain to me exactly what that means. I've got kind of an idea, but the more information you can give to me, that would be great. And how you do that is jump in and send your questions or your tips to info@PEMFprofessionals.com. And become a member today. It's pretty easy. It's very inexpensive when you think about belonging to an international organization. Again, we're in 17 countries. We're over 1,000 members, and we're growing. You guys are getting in on the ground floor. of this international organization. And the more we are out there, the more people know about us and what it is that we do, how we serve our members, the better. So take a look at our new website, check out our merch, come back and see me next week, check out our broadcasts. And I look forward to hearing from you. Lauren and I, we definitely look at the emails when they come in. We respond as needed. If you're on our Facebook, then jump in on the instant messenger. You can reach us that way too. So send us an IM or a email. So again, with that, I want to thank you so much for your time today, and I look forward to hearing from you. And again, seeing you next week on our next broadcast here at the Association of PEMF Professionals. So thank you.